The topics I intend to cover live at the OYTT program will include structural shortcomings in a yoga practice. Secondly, we will try to understand the commonly injured tissues in a movement-based practice like yoga. Try to understand the challenges which one can face while sequencing a yoga practice, especially in a mixed group where there's a lot of musculoskeletal conditions. Namaste, I'm Dr. Rajbir Dhillon, a physical therapist specialized in musculoskeletal and sports injury. I have been associated with the Himalayan Yoga Valley as a clinician, handling all sorts of musculoskeletal and orthopedic conditions for the students. Within this well-crafted program, I will try to add clinical value by bringing in the essentials of applied anatomy and rehab sciences to understand the therapeutic elements of yoga. The topics I intend to cover live at the OYTT program will include structural shortcomings in a yoga practice. Secondly, we will try to understand the commonly injured tissues in a movement-based practice like yoga. I say movement-based practice because you may, or the students or your students may be doing a lot of other activities, movement-based practice as well. So how you can be careful in those practice so that it helps your yoga practice improve or vice versa. So we'll discuss about that. Other than that, we'll try to understand the challenges which one can face while sequencing a yoga practice, especially in a mixed group where there's a lot of musculoskeletal conditions, and again the same topic where we will understand the one-size-fits-all may not work. And then we will also cover a few more other injuries, the technicalities behind it, understand the practical implications of that. So rather than learning elaborated theories, we will try to focus on foundational principles that can in general work as a springboard for us to understand limitless applications. So if you are fascinated by human body like I am and want to understand its mechanics, functioning, and want to view it through the prism of a physio-based applied anatomy, then do join me live in my classes, and we will try to explore more, discuss more, interact more to unlock the potential that we have to understand applied anatomy. So sign up if you haven't till now. If you have registered, then sign in. Looking forward to see you live in my classes.